My name is Amy, and today I will be presenting an educational PowerPoint on postoperative pain assessments and management and how these two aspects of nursing care have the ability to lead to severe consequences regarding the patient. The International Association of the Study of Pain defined pain as being an unpleasant sensory and emotional experience associated with actual or potential tissue damage. Postoperative pain occurs through the inflammation and activation of the nociceptors at the site of incision, causing the patient pain during movement and rest while in the immediate postoperative period. Approximately 235 million individuals undergo a wide variety of surgeries, where roughly 75% of these patients report severe to moderate postoperative pain with inadequate pain relief. In Australia specifically, during 2017-2018, it was recorded that 352,000 individuals had emergency surgeries and 2.2 million Australians had elective surgeries. From the Australian Institute of Health and Welfare, they recognise that those who are living in rural and remote areas, those of the male gender, and those who are living in low socioeconomic populations were more inclined to experience and suffer from postoperative pain due to their high rates of emergency surgeries. As well as this, Aboriginal and Torres Strait Islanders were twice more likely to be associated with surgeries than those from non-Indigenous backgrounds. Postoperative pain must be sufficiently assessed and managed in order for patients to have a functional recovery, minimise discomfort, and prevent chronic pain in the future. Postoperative pain that is not dealt with appropriately has a tendency to decline one's quality of life, provoking limitations such as prolonged ambulation, ultimately causing a patient to experience chronic pain later in life. Chronic pain is said to account in 10 to 50% of all patients undergoing surgery as a result of poorly managed pain. Patients experiencing postoperative pain for a longer duration of time, as well as pain in greater severity than anticipated, are likely to require a more lengthy period of opioid administration. Although opioids are recognized as being the most effective treatment in managing pain, there are consequences associated with the lengthened use. Such consequences include an increased risk of severe nausea and vomiting, and possibly respiratory depression that can lead to death. As well as prolonged opioid use, these groups of patients experience the economic impact of a prolonged hospital stay. The acute pain experiences causes the patient to have an extended length of care, causing a rise in bills, placing the individual in financial stress. Due to pain being recognized as a subjective judgment, it is fundamental that nurses give patients the ability to accurately articulate their pain in order for the correct assessments and managements to take place. The numerical scale is a subjective measure of postoperative pain that allows patients to self-rank their pain on a scale of 1 to 10, with 0 being no pain at all and 10 being the worst pain they've ever experienced. This tool takes into account the patient's perspective of their pain, ensuring that they are in control of what pain management they receive. The PQRST assessment incorporates investigating the patient's pain systematically under the headings of provoking factors, quality of the pain, radiation of the pain, severity, and time. This allows for nurses to have a specific idea of the pain the patient is feeling, allowing for accurate management. However, these pain scales are not appropriate for population groups including children, as they are unable to speak for themselves and appropriately verbalize their pain. The Wong-Baker-Faces scale and the Flack Painter scale assessment are both suitable for children as they correlate the child's presentation and behavior with a certain level of pain, such as facial expressions. Subsequently, after the assessment of a patient's postoperative pain, management of the pain must take place effectively and efficiently to ensure patients do not experience any of the consequences. Opioids are a pain-relieving medication that are frequently administered to patients through a PCA machine in order to reduce their moderate to severe postoperative pain. This allows the patients to be in control of when they receive their analgesia, promoting pain relief. Although opioids and PCA machines are the predominant treatment for pain, they do contain the ability to express quite severe side effects such as sedation and respiratory depression, as mentioned before. Due to these harsh side effects, multimodal analgesia is preferred, as it is the administration of a combination of analgesics that manage postoperative pain and avoid the unwanted side effects. For example, administering morphine in a smaller dose but also administering paracetamol in conjunction. Non-pharmacological interventions are able to effectively treat someone's postoperative pain. For example, nurses provide the patient with education on what to expect after surgery in the perioperative phase. Patients can also be provided with insight on the use of distraction therapies, such as listening to music, meditation, and deep breathing exercises in order to manage and stabilize their pain. One barrier to achieving managed postoperative pain is the lack of knowledge of nurses on pain assessments. Unfamiliarity to pain assessment tools is prevalent among nurses, where a study recognized that 37.1% of nurses truthfully verbalize their lack of knowledge regarding pain assessments and management. Undergraduate education has been recognized as not providing nursing students with the sufficient awareness and skills required to accurately manage one's pain in the postoperative setting, where this same study was able to identify that more than half of the undergraduate nurses' knowledge regarding pain assessments was unsatisfactory. An outcome of poor knowledge surrounding pain assessment causes nurses to poorly manage a patient's pain, leading to unnecessary pain to be prevalent worldwide. The absence of knowledge of patients regarding opioid use is seen to be a barrier to adequately assessing and managing pain. A study conducted recognized that over 50% of patients in hospitals did not have adequate knowledge on opioid use. Patients who are naive to opioids are identified to believe that opioids are addictive agents, where this impedes the ability of nurses to administer pain-relieving agents, as these patients are effusive due to the severe concerns of the possible outcomes. Communication between nurses is a vital aspect of ensuring patients are receiving essential care and sufficient pain management, as nurses are consistently working in a team, where poor communication can lead to misunderstandings regarding the patient's pain management plan. Communication between the nurse and the patient must be clear and effective to ensure there is an understanding of the patient's pain, allowing for strategy development and vital considerations, such as whether the patient is opioid naive. Communication-related errors accounts for approximately 15% of all errors made by nurses worldwide, highlighting the significance of communication between nurses and patients regarding their pain. Strategies and interventions need to be put in place in order to reduce the amount of individuals that are experiencing unnecessary postoperative pain and who are not acquiring satisfactory management. Ways to improve the current circumstances surrounding poorly assessed and managed postoperative pain include further education within nursing schools, educational lectures from pain assessment teams, and education aimed towards the pain perioperatively through engaging pamphlets. Due to there being an inadequate amount of emphasis placed on the education of pain within nursing skills in undergraduate workplaces, nurses are not skilled nor experienced enough to manage postoperative pain. Increasing the education of student nurses can be completed by implementing another subject primarily focused on pain assessments, and ways in which to manage pain. Furthermore, education for undergraduate nurses already in the workplace can be provided with easily accessible educational resources, such as the pain assessment team and their resources, including scheduled educational lectures from experts and their reliable sources. Providing patients with education perioperatively has been researched to have an impact on patients postoperatively, where they have a sense of control over the experience. Interventions and strategies that can be implemented to highlight this can include the addition of a written information tool. This educational pamphlet provides the patient with possible side effects of the surgery, associated medications, how to use patient-controlled analgesia, non-pharmacological interventions that would best suit them, what to expect after the surgery, and how they can best manage this apprehension regarding postoperative pain. Thank you for listening, and I hope you did find this educational PowerPoint helpful for how you treat patients in the future for postoperative pain.